are no less sick and oftentimes actually have more illnesses and more pre-existing conditions, many of them undiagnosed because they haven't had the access to a physician or a dentist or someone like that. And so as we've looked at the penetration, and when I say penetration, the percentage of people in various parts of the community who have received the vaccinations, we see wide disparities. And that's something that I think in a just society, you don't want to see. You don't want to see these wide disparities. And so that's why we're making a special effort to reach out to those individuals. Another factor that corresponds to this is many of the first groups of people that have received the vaccinations are going to be people who live probably in more affluent areas. If you talk about people who are healthcare providers or people who have access to having that type of care, they're going to probably be in a situation where they're going to be eligible earlier. And again, we're looking for equity. We're looking for fairness in our community, in our society. So again, just as an example, tomorrow vaccinations will be taking place at Greater New Birth Church. This is a church on the northwest part of the city of Milwaukee. And we want to make sure that we're going into those neighborhoods where we have identified a low percentage of people who have received the vaccinations. And starting next Monday, vaccines without appointments will be available at North and South Division High School. Again, both in areas where we have seen a disproportionate number of people who have not gotten the vaccines. But at the same time, we've seen a high percentage of people who may have pre-existing conditions or have other challenges that put them in a very difficult situation. So again, for residents 18 and up who live in the 10 most vulnerable Milwaukee zip codes, and those are 53204, 05, 06, 09, 53215, 1618, 23, 24, and 33. But we also know this. We know that the gas is starting to flow in, if you will. More and more vaccinations are coming to our community. And I anticipate in the coming weeks that we'll be able to do even more vaccines. And that's my hope, because we're working closely with the county, we're working closely with the state, we're working closely with the federal government to get as many vaccines here as possible. So that's on the vaccine front. But there's also the issues about, well, what about businesses? What about society? What about schools? What are we doing? Because as Dr. Weston will tell you, we have made considerable progress in bringing down the positivity rate and the number of people who are sick. And both of those are very positive. And what we have done, and I'm proud we've done this for over a year now, is we've looked at the science. We've been guided by science, and we've allowed science to provide us with the guidepost as to how we should move forward. So based on our promising numbers, we are cautiously optimistic about opening up the city to a greater degree under the Milwaukee Health Department's new public health orders. The orders will be effective starting tomorrow. And Commissioner Johnson will review the order in greater detail. But what is significant to note is that the order loosens some restrictions for many establishments. For example, restaurants and bars will see an increase in possible capacity and an easing of the restrictions on movement of patrons inside the establishment. Sporting events and recreational activities are now permitted to have up to 6 spectators per event participant, with a limit of 750 fans indoors or 1,000 fans outdoors, as long as physical distancing can be accommodated. An approved safety plan can allow larger crowds, and that's exactly what happened with the Bucks and the Brewers. They came to us with a safety plan. The health department approved it. That's why you will see larger numbers there. So again, the 750 for indoors, 1,000 fans for outdoors, that can be modified upwards too if you have a safety plan that's been approved by our health department. And I think this is one that's very important for grandchildren, for children, for everyone. The order no longer restricts visitors to long-term care facilities. So all those heartbreaking stories that we see about grandma or grandpa not being able to talk to their grandkids in person, I'm hoping we'll never see another one of those stories in our lives. But we've also revised the gating criteria. Those are the facts we incorporate in the decision-making process when we change the public health order. And Commissioner Johnson will have more on that too. one of the things that we want to do is we want to keep the momentum going in a positive direction. And so we don't want to have a situation where we go to one phase, if you will, and then we have to retreat the next time we make an evaluation. And so that's sort of built into what Commissioner Johnson and her staff have done. Obviously, on a very related front, but a little bit of a different front, we are looking forward and making plans to invest our federal rescue funds in a way that will have the most positive impact for our city. And I've had good conversations with County Executive Crowley. I've been talking to people from Governor Evers' administration, and we certainly will prioritize the public health response to the pandemic. We're also going to be filling the holes that were created last year with the loss of revenue, but we'll also be looking for support for housing, jobs, the local economy, and infrastructure. So we view this as an opportunity. It'll be a challenging opportunity. It's not an overnight sensation. In other words, we're looking at this as funds that will be available to us through the end of 2024. And we want to coordinate with the county. We want to coordinate with the state so we get the most bang for the buck for as many people as we can. Finally, from fun to the testing, yesterday, we had 494 people at American Family Field. We had 87 at the Northwest Health Center. We had 80 at the Southside Health Center. So those sites continue to be used, but clearly the numbers are lower there. But the final thing I'll say is one of the things that I think we all have to remember, that if you're experiencing symptoms or think you may have been exposed to someone who has tested positive for COVID-19, please get tested. Please get tested. And with that, I'm going to turn it over to County Executive Crowley.
Well, thank you so much, Mayor Barrett, and thank you all for joining us. On Wednesday, our country experienced a tragedy. A mass shooting took the lives of 8 people, 6 of whom were women of Asian descent. And I want to offer my condolences to the friends and families of these victims. This shooting was an abhorrent display of blatant racism aimed towards Asian Americans that we've seen rise throughout this pandemic and showcase the dangerous crime related to male supremacy many women are already aware of. We must call this what it is, and it is a hate crime. And men, we need to do better. It doesn't matter if you aren't a part of the problem. You must actively be a part of the solution. Do not support anyone who shows signs of this types of behavior towards women, including your family and friends, and we must call it out. We also saw a workplace shooting closer to home with 2 men killed in a shooting in Oconomowoc. And for all those hurt and concerned, I encourage you to seek some support. There are many mental health resources in the Milwaukee area to guide you through these difficult times. And if you need support, please call our Milwaukee Behavior Health Division crisis line at 414-257-7222 for assistance. Again, that number is 414-257-7222. I also want to acknowledge a somber anniversary. On March 19th, 2020, Milwaukee County had its very first COVID-related death. And I empathize with all the families mourning loved ones as this virus has ravaged throughout our country. One death is too many, and we've seen hundreds of thousands of those, of many people lose their lives to COVID. And this should serve as a reminder to practice physical distancing, wear a mask, and wash or sanitize your hands whenever possible. And now, as this vaccine continues to roll out, we hope you'll choose to get this shot when it's your turn. I also want to clarify some information surrounding our new vaccine eligibility based on zip code data and the CDC's social vulnerability index. So again, starting Monday, the 22nd, all individuals with a chronic health condition are eligible to receive the vaccine. And anyone, all people, anyone 18 years of age or older who lives in the 10 county zip code rankings, which is the 10 highest ranking zip codes on the CDC social vulnerability index, will get vaccinated. And I'll repeat these zip codes again. They're 53204, 05, 06, 09, 15, 16, 18, 23, 24, and 33. Again, all people ages 18 and older who live in these 10 zip codes are eligible to receive the vaccine. And those eligible can visit milwaukee.gov/COVIDVAX, that's VAX, or covidmke.com to make an appointment. And we've seen almost 5,000 registrations since Tuesday, and this is encouraging. And we're going to continue to schedule appointments and administer the vaccine as efficiently as possible. And Fema is currently working to hire for the immediate non-medical vaccine support positions in our area. These are temporary local positions that will assist with the disaster response and recovery efforts that is directly focused on COVID-19. And FEMA is looking for candidates with experience in customer support and or emergency management. So if you want to apply, you can visit usajobs.gov, and you have to visit USA Jobs to fill out the application because those are the only applications that will be accepted. On March 19th, that is the application deadline. So please be sure to apply soon if you are interested. And with that, I'd like to hand it over to Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we are currently seeing an average of 62 new cases a day and about 1 death every 2 days. And we're administering now over 6,200 doses of vaccine per day on average, which is about a 5% increase since last week for Milwaukee County. On Tuesday, we released the newly developed EVE model, which stands for Evaluating Vulnerability and Equity. The EVE model considers the CDC's Social Vulnerability Index, as well as vaccination rates. And based on these 2 factors, the EVE model categorizes community into one of 4 categories. However, at this phase in vaccination, our county really falls into 2 categories. It's more of a tale of 2 cities. On one hand, we have the high vulnerability communities that have not received as much vaccine. And on the other hand, we have the lower vulnerability communities that have received much higher levels of vaccine. Unfortunately, right now in Milwaukee County, there's not much space in between. These are the disparities that we're working to address. By moving up the health condition eligibility, the state will open vaccine availability to a much broader swath of our county. And in a more targeted way, by opening up all eligibility to anyone 16 years and older in our 10 most vulnerable zip codes, we're deliberately offering vaccines to our most disadvantaged communities. Of note, these 10 zip codes include over 230,000 individuals in our county. In focusing on systemic racism as a health condition, recognizing its effect on chronic stress, on health conditions, and ultimately health outcomes, this targeted approach tackles these disparities head on. As examples, we see in our country that people of color have lower rates of health access. And this is coupled with higher rates of high blood pressure, of diabetes and asthma, as well as higher rates of death from diseases like cancer and overall shorter life expectancies. By opening eligibility to anyone 16 and older in these 10 zip codes across vaccination sites in our community, we can better reach everyone in these communities. So if you are a 20-year-old in 53206, get vaccinated, but at the same time, register and bring along your parents, your grandparents that live in that zip code as well. If you're a 30-year-old in 53204, get vaccinated, but register and bring along your elderly neighbor. Through this program, you can truly get your household as well as your community vaccinated and protected from COVID-19. We've had a tremendous response to the zip code program. People have logged onto the county website at covidmke.com and the city website at milwaukee.gov/covidvax with an X in the thousands. The response has been outstanding, and it's shown the overwhelming interest in this vaccine from an extremely diverse segment of our community. Those who are coming to the site and signing up know that this is a safe and effective vaccine. And after you've received your vaccine, be the ambassadors to your community. Reach out to your friends, to your neighbors, to your family. Let them know why you chose to be vaccinated. Let them know what your experience was and share that the vaccine is safe. The sooner we can reach all segments of our community with this vaccine, the sooner we may no longer worry about our parents and our grandparents becoming ill, becoming hospitalized, or dying from this disease. So be our ambassadors, tell your story, and help us to end this pandemic. Thank you and stay safe, and I'll hand it to Greenfield Health Officer Darren Rush.
Thank you very much, Dr. Weston. It's a pleasure to join you today to provide a brief data update from the Epidemiology Intelligence Unit. As Dr. Weston has stated, the numbers remain pretty flat and what we continue to call a plateau for countywide COVID-19 cases over the last several weeks. Really, since about mid-February, we have been very, very stable with the average number of cases in any 7-day period. And we see that both in the city and in the suburban communities. It's also of note that we see that same pattern in our kids. When we look at kids under the age of 18, we see a very similar plateau of numbers, which is very, very positive. But yet I'll remind everyone that even at these low rates, we know disease transmission is occurring. So let me go ahead and share the screen, and I'll hit a couple data highlights for today, and then we'll move on with some other comments about vaccination efforts. So here on the screen, you can see the daily number of new cases for COVID over the last year and a week. And you see really stable numbers, numbers that we haven't seen, or rates that we haven't seen really since probably late summer, and remaining very flat. That's very, very positive. And as Dr. Weston noted as well, deaths have dropped off considerably, and we're seeing 0 to 1 deaths a day on average, which is very, very good. And I think that speaks largely to the high vaccination rates in our older adult populations that have been the most vulnerable and have had the most significant complications from COVID-19. Next, I wanted to take a look at our transmission rate. We've looked at this before, and this is the number that tells us how well we're suppressing disease. And we want to see this transmission rate below 1. We have, in the last several months, bounced above 1 in mid-February, and we were certainly approaching that a couple weeks ago, and certainly now we're below 1, which means we're suppressing disease in the county. Unfortunately, when we look at the trends in the city and the suburban communities, we see a little bit different patterns. You know, Milwaukee, city of Milwaukee looks more like the county overall with an R value of about 0.85. But in the suburban communities, we're approaching 1 again. So we want to be very careful about that and try to limit the spread of our disease. As has been mentioned by Mayor Barrett earlier, testing continues to be well available in the community. And when we look at our testing numbers, certainly we've been averaging about 20,000 tests countywide over the last several weeks, which is good. But please know there's additional capacity if you need a test or want to test. Our trends are very, very flat, and that certainly correlates with certainly flat rates of disease as well. Lastly, I'll leave you with just a look at the spatial map for the most recent week. Again, this is where we're looking at new cases of disease over the last 2 weeks, and we're specifically focusing here on the 2-week period between March 3rd and March 16th. And areas that are red and orange have had more cases of COVID-19 relative to others. So we still see pockets of disease in and around the county, with very few portions of the county not having any disease at all. So moving away from the data a little bit, I want to talk about the vaccination efforts. And we've talked about, and the data is available about how those rates are increasing, both in Milwaukee County and in other parts of the state. And certainly Dr. Weston has talked about initiatives, as has Mayor Barrett and County Executive Crowley, about getting more vaccine into high-risk areas. I just want to remind everyone that we have 3 safe and effective vaccines. We have Pfizer, Moderna, and Johnson & Johnson. And largely the differences in the vaccines are really based on the technology and how they were created, how they were tested, how they work in the body, as well as the number of doses. We know the Johnson & Johnson vaccine that's been available this week in a few areas around the county is a 1-dose vaccine. We know Pfizer and Moderna are 2-dose vaccines. But I want to continue to tell you that they're all effective, and the appropriate dose for you is the one that's available to you. We in public health, like other community vaccinators, we just simply don't know what inventory we're going to have at any particular time, and we can't guarantee a particular type of vaccine. But when you see signups, oftentimes you'll see we have Moderna, we have Pfizer. Those sorts of clues will tell you what vaccine we have. As we've talked, eligibility is set to expand throughout the state next week. Again, unfortunately, eligibility does not always equal availability, especially as we know more people are becoming eligible. It's becoming quite common to hear us also say that allocations are increasing, and they are, but they're increasing incrementally. In addition to increasing vaccination allocations, we're also seeing additional community vaccinators and additional community sites coming online. As you've heard today, as well as we've talked about in previous briefings, medical providers and medical clinics are great sources for vaccination. Pharmacies, local health departments are great sources for vaccination. And we have other collaborative community approaches that are coming online, as Dr. Weston and others have mentioned, with Milwaukee County's Office of Emergency Management efforts, as well as efforts happening at UWM, Fema sites, and others throughout the area. I want to urge everybody to please get vaccinated whenever you can, because it's an important part of the strategy to lessen the impact of COVID in our community. Lastly, I want to address what happens after vaccination. In the post-vaccination period, while your immunity builds, you need to continue to wear your mask out in the public, around other people who are unvaccinated. Follow the 3 W's. Wear the mask, wash your hands, and watch your distance. The COVID-19 vaccines will provide full coverage and full immunity about 2 weeks after the last dose. So that'll be 2 weeks after the second dose for Pfizer and Moderna, and it'll be 2 weeks after the single dose of Johnson & Johnson. Once you achieve full immunity, you have the opportunity to gather indoors with other fully vaccinated persons. You also have the opportunity to gather indoors with unvaccinated persons from low-risk households. This is the scenario that Mayor Barrett talked about, with a grandmother hugging a grandchild who is low risk for severe COVID disease. But most importantly, with vaccination, you've done your part to build community immunity, the term we've called before herd immunity, to lessen the impact of COVID-19 in our communities. We cannot defeat COVID without vaccination and without continued vigilance on the 3 W's throughout Milwaukee County. Thank you very much for your time, and I'll now turn the briefing over to my colleague, Kirsten Johnson, with an update from the Milwaukee Health Department.
Thank you, Darren. The Milwaukee Health Department has issued a new order today, which goes into effect tomorrow, March 19th at 12:01 a.m. The new Phase 6 order is based on updated gating criteria. The gating criteria were updated to more closely align with CDC guidance. We have added disease burden as a measurement and the adult vaccination rate. We measure burden as the number of positive COVID-19 cases per 100,000 people. As of Tuesday, March 16th, our burden in the city of Milwaukee is 45.9. This is the lowest it has been since March 20th, 2020. Additionally, we have added the percent of adults who are vaccinated. This number is intended to represent the goal we have set for the city of Milwaukee. As of today, only 8.5% of adults in the city have been vaccinated. Our intention with the new orders is for Milwaukee residents, businesses, and organizations to have a better understanding of where we are headed, or if cases reverse and begin to increase again, where we would go back to. The most significant changes are restaurants and bars can open to 50% with no safety plan, and standing is permitted. Eating and drinking can only occur when individuals are stationary or seated. Gatherings are permitted indoors at 75% capacity with a maximum of 750 people or 1,000 people outside. With a safety plan, the Milwaukee Health Department will allow greater capacity. Our museums are welcome to open fully. Retail capacity is limited by ability to physically distance between groups. Salons and spas are now allowed 3 clients per service provider, and childcare is at full capacity. Schools are able to open for full in-person instruction with masks and physical distancing of 6 feet or more to the greatest extent possible. We continue to ask individuals to wear their masks, physically distance, and wash their hands. I am cautiously optimistic that our case numbers will continue to decline while our vaccinations increase, and I am hopeful that this provides some relief while continuing to keep our community safe. More detailed information about our order can be found at milwaukee.gov/MMFS. Thank you.
Thank you, Commissioner Johnson. Our first question from the media comes from Latoya Dennis at WUWM. For our health officers, with so many more people becoming eligible beginning Monday, is supply still an issue? If so, when do you expect supply to match demand?
Yeah, so in short, as I mentioned earlier, eligibility doesn't necessarily mean vaccines available. The supplies coming into local health departments have remained pretty stagnant over the last couple weeks. But what we know importantly is that there are more doses coming into Milwaukee County overall. The Fema site, for example, has vaccine. And we certainly know there are many, many other vaccinators in the community, including others that have come on in recent weeks. So while we know there's going to be many, many, many people eligible, vaccine will be there, but it's not likely to be there on day one, unfortunately.
And we anticipate in the city of Milwaukee to have about just shy of 20,000 doses per week for the next 2 weeks.
Our next question is from Joyce Garbasiak at WISN 12. What steps are being taken to ensure people who show up for Vaccinations Monday have pre-existing conditions? Will people have to have a doctor's letter or some other type of confirmation that a person genuinely has a qualifying condition? When will registration for those new, there's a second part. People who become eligible Monday still cannot book an appointment for a vaccine next week. When will registration for those newly qualified individuals as of March 22nd open on the city's site?
Sure, I can answer both those questions. So registration is generally opened 5 days in advance. I do think that we are booked for the next 5 days, but then they'll be opened further over the course of the weekend for next week. I'm sorry, I can't remember the first question. Oh, verifying eligibility for vaccine. We are not asking for proof of underlying health conditions. We are asking that people are honest and wait their turn. But we're hoping people who do have underlying health conditions are coming in to be vaccinated.
And I'll just chime in. The one that jumped out at me was BMI. And I got in trouble with my staff because I said, I don't know many people who have a BMI. Maybe I said, I don't know anybody who's got a BMI less than 25. And my staff didn't appreciate my saying that. But the fact of the matter is that a lot of people are going to be eligible just on that one alone.
Our next question comes from Allison Durr at the Milwaukee Journal Sentinel. When Order 4.4 was issued in early February, there were questions about what effect the virus variants may have in the community. A month and a half later, what is your assessment of how and if the virus variants have had any effect here and why it has unfolded this way?
I can speak a little bit to the virus variants, and I'll call on Dr. Weston to speak more fully on it. But we didn't know what the impact the variants were going to have on the city of Milwaukee. We do know the variants are here, but it has not impacted in any way, notable way, the number of total cases that we're seeing. So we continue to see the decline despite the knowledge that those variants that do exist are in the city of Milwaukee.
Yeah, I can just add to that. So I would agree. We have not seen a change in our number of cases, in our percent positivity, or in our hospitalizations or deaths that would suggest an issue from the variant. Now, when we look around the country and we see particularly the states that are doing a lot of testing for variants, it's reaching probably around 50% in many parts of the country. Now, 50% is where we saw turning points in many countries throughout Europe. That's typically where the amount of variant builds up enough that you start to see it taking off in cases and positivity rate as well. So it's certainly something that we'll keep an eye on in the coming weeks to see if we're having any change. But hopefully with continued careful vigilance and continued rapid vaccination deployment, we can keep as low as possible.
Another question from Allison Durr for Commissioner Johnson. Could you explain why you're changing the gating criteria now and what the impact of that change is expected to be? Will any of the previous gating criteria be considered at all in future decisions, and will it still be publicly tracked?
Sure. So we decided to change the gating criteria now because we wanted to more closely align with the CDC guidance that's come out. And similarly, guidance from DHS is more closely aligned with the gating criteria we just released. We are continuing to track our previous data points and will be using them in the future. I'm hopeful that we won't have to use them, that we'll continue this downward trend, or at least stay at a plateau while more people become vaccinated. But if in the unfortunate situation that we are reversing course, we will continue to look at those data points.
Our next question comes from Sharon Bajenda at CBS 58. What is the Milwaukee Health Department doing to make sure they are not easing restrictions too quickly amid variants and vaccination rollout?
And this is similar to what Dr. West said. We are watching this data very carefully. We were on track to have released a new order, I believe, 2 weeks ago, and actually held it because we wanted to make sure that the data trend we were seeing was going to continue down in a downward trend. So, and it has. Over the last 2.5 weeks, we've really been steady, which is why we feel comfortable releasing some restrictions. And again, if we start to reverse course at any point, we will ramp those restrictions back up again and really try to assure that we keep our community safe. And again, the guidance on the phasing is public, and we really wanted to make sure that our businesses and organizations, schools knew where we were headed and where we would be going back to if needed.
Our next question is also from Sharon Bajenda for Dr. Weston. Is the country in a race between variants and vaccinations? Are we getting vaccines quicker now, or has there been a significant increase in supply in the Milwaukee area?
Yeah, I think that's a good way to describe it, that we're on a timeline right now. We know that the variants are spreading. We see that when we test for the different virus variants. So we know they're spreading. We know that they're more contagious. There seems to be more and more emerging evidence that at least the B117, or often called the UK variant, is also more severe. That's the one that's most predominant in our community and in the United States in general. So I think, yeah, I would say we are on a timeline or in a race with the variants. But so far, we're seeing flat numbers, which is as encouraging as can be. As far as the significant increase in supply, we're at about 6,200 doses of vaccine per day on average right now. And that's a 5% increase from what we saw last week. We hope for that to continue to increase each week going forward.
Next question is from Brittany Lewis at CBS 58. Can you please clarify, is the zip code program for those 18 and older or 16 and older?
So the zip code program is for individuals that is 18 years and older. And Dr. Weston, correct me if I'm wrong, but we have the Moderna dose. And so that is for 18 years of age and older. Only the Pfizer has been slated and passed for 16 years of age and older.
That's right. That's right. So for Milwaukee County at Kosciuszko Community Center, we only have the Moderna. So we are only able to vaccinate people 18 years and older. The Milwaukee Health Department, I don't want to speak for Commissioner Johnson. They have, I believe, a combination of different vaccines. So in that case, with Pfizer, anybody 16 and older would be eligible from those zip codes. If you have other vaccinators that choose to participate in the zip code program as well, and to be clear, it's open to anyone. This is not a Milwaukee County, City of Milwaukee vaccination site only program. This is new eligibility criteria for any vaccinator that wants to participate. And so if a vaccinator has Pfizer, it's 16 and older. If you have Moderna, it's 18 and older.
And the City of Milwaukee Health Department at our site, both at the Wisconsin Center and our community sites, we will stock Pfizer to assure that we can do 16 and older.
Our next question is from Sari Lesk at the Milwaukee Business Journal for Commissioner Johnson. Could you please confirm whether I'm reading the details of the new gating criteria correctly? Based on the numbering system, it appears you're saying if the gating criteria deteriorate, you could first move backwards to a middle ground between tomorrow's new rules and the rules in effect today. Is that correct?
No. So we're moving forward with the rules that I said today. So the phase 6 is where we're planning to be tomorrow. And we've been, again, tracking the data. There's no intention of moving backwards before moving forward.
Also for Commissioner Johnson, for how long will you evaluate the gating criteria before making a decision about staying with the order or shifting? Meaning if the metrics improve or deteriorate, how many days would they have to stay that way before you make a decision about the restrictions?
Sure, we're tracking it over a 14-day period. So if we see, that said, if there's a significant spike that we see as alarming, we may change course, but we're going to review it every 2 weeks, every 14 days.
Our next question is from Angelica Sanchez at Fox 6. MPS might bring all students back to the classroom April 12th. Are they able to bring students back sooner with this new phase starting on Friday?
It's my understanding that the school board is going to be meeting on Tuesday, and the question posed is whether they would all be coming back on April 12th. Again, my understanding from what they will be discussing is that the youngest kids would come back April 12th. The middle kids, for lack of a better term, would come back a week later, and then the high school kids a week after that. So whether they could come back earlier or not, the school board has not yet met and approved that. It's my hope that there will be a plan next week that will allow them to go back according to schedule. We at the City Health Department really have done a lot of backward somersaults because we felt so strongly that we wanted to make sure that the teachers had access to the vaccines. And we've been very successful in making sure that teachers and other educators and other people working in the schools have had the vaccination. So we're very proud of that effort. And now I think it's simply going to be, what is the plan for them to go back and informing parents, informing teachers. I think it's safe to say that there are some parents who want to keep their kids learning virtually. There's others who very much want to get their kids back into the classroom. And that's probably same for the students. Some want to go back, some want to stay out. But in terms of the legal impediments, under the plan that's been approved, they certainly will be able to go back on the timetable that they're contemplating.
Our next question is from Courtney Sisk at WISN 12. As restrictions lessen, how can you regain trust in the community that restaurants, bars, gatherings are safer to attend?
I really think it's up to individuals to determine how safe they feel. I mean, everyone has a different comfort level with risk. There's risk still exists, but we know that with the mitigation plans that are in place, social distance, physically distancing, wearing masks, and with increased number of people becoming vaccinated, that it is becoming safer to gather in these settings.
Our next question comes from Joyce Garbasiak at WISN 12. How has FEMA's presence affected the implementation of the vaccination process at the Wisconsin Center? Has capacity increased? Are things going more smoothly? Also, any update on mobile vaccination sites now that FEMA is firmly in place here?
I'm going to jump in here because I want to thank FEMA. They have been such a great partner. The commissioner is smiling. I'll let her get into the details, but I think it's important that we acknowledge just what a great partner FEMA has been. And FEMA's presence has affected the implementation of the vaccination process at the Wisconsin Center. It's getting bigger, and we're happy about that. And equally important, it really frees up our City of Milwaukee Health Department to have these mobile sites and to get into the community. So it's a win-win situation. Are things going more smoothly? Actually, they were going very smoothly to begin with. I can't think of anything that I've ever been involved with where we've received more compliments from people who have come in and gotten a government service. So I think things have gone very, very well prior to FEMA. I think they continue to go well. And I'm very happy about both of those things. So I'll turn over to the commissioner to fill in the details if she has anything to add.
Sure, I think it's been going incredibly smoothly. And with FEMA on site, we did a really great transition on Monday with their staff. So I think all of my staff are incredibly thankful to have them there, and it's going very well. And it has, as Mayor Barrett said, really relieved some of our staff to be able to go back out into these community sites. So we are planning to open North and South Division High School on Monday. And at a minimum, we're planning to do 2,000 doses per week at our community sites, and it's likely going to be significantly more. But as of now, we're around 2,000 doses a week. And then we also have a large event planned for tomorrow at Greater New Birth Church. Again, because of FEMA's presence, we are able to focus more closely on our community sites, really to address those health disparities that we think are so critically important.
Jumping back to one question in the queue from Shemaine Mills at WUWM. Again, clarification on the minimum age in the 10 zip codes eligible. Is it 16 or 18?
Yeah, we may not have been clear on this. So just to be clear, the age is 16. Depending on which site you go to, the Pfizer vaccine may not be available. So the county site is only Moderna. So we would only be able to vaccinate people 18 and older. But at Milwaukee Health Department, for example, 16 and older because of the vaccine they have on hand. So the short answer is anybody 16 and older in those zip codes is eligible.
Thank you, Dr. Weston. Another question from Allison Durr. Can the commissioner clarify, is the city expecting to receive 2,000 or 20,000 doses in the coming weeks?
We are expecting 20,000 doses per week in the coming weeks, but off the top of that, we plan to take at a minimum 2,000 to our community sites. And probably more.
Follow-up question from Sari Lusk for Commissioner Johnson. Clarifying my first question. The new order is called phase 6, and that's following phase 4.4. Where we are today? If trends start moving in the wrong direction, would there then be a middle ground between tomorrow's new restrictions?
Yes, so thank you for clarifying. You're correct, we're at 4.4 right now. We are skipping phase 5 and moving straight to phase 6 because of where we land with our data and our gating criteria. If things start to slip over the next 2 weeks, we would go back to 5, which is a middle ground between 4.4 and 6. Thank you for clarifying.
Another question from Joyce Garbasiak at WISN. The teachers union says they're not ready to come back, citing bad ventilation in old MPS buildings and an inability to fix that by the time this school year ends. What can you say to assure MPS teachers that they will be safe once in-person school resumes?
Again, I'll simply say that the city of Milwaukee worked closely with the superintendent, with others in the school system to make sure that every single Milwaukee public school teacher that wanted to receive a vaccination receives a vaccination. And we're extremely proud of that partnership because we did feel it was important to give them that opportunity to get that vaccination, and we've been successful in doing that.
That appears to be the last question in chat for today. Are there any further questions from the media for our panelists? All right, thanks everyone for joining us today. We'll see you back here on Tuesday.
Thank you all.
Thanks, everyone.